Hello ladies, welcome back to my channel. So today I'm going to continue the discussion on anxiety, and we're going to focus on plant-based medicines for the relief of anxiety. So I'm talking specifically about CBD and cannabis. So for those of you who don't know, I am also a cannabis clinician. I work with medical patients who want to see if cannabis would help them in managing their disease. So I'm actually a cannabis patient myself. In terms of full disclosure, I have a neurological movement disorder. It's called essential tremor. And I was able to get off my anti-seizure medications by using a predominantly CBD protocol. So it was such a life changer for me to be able to get off of my prescription meds that I just started working with other people who were interested in using alternative types of medicine to manage their disease. So today I just wanted to inform anybody who's interested on how they can use CBD to help alleviate their anxiety. So often what happens is when women go to their physician's office with complaints of anxiety, depression, irritability, anger, a lot of emotionality, a lot of times physicians don't recognize it as menopausal symptoms, and so they will prescribe anti-anxiety medications like Ativan, Valium, etc., which are very dangerous drugs. A lot of overdose deaths are attributed to those types of drugs. And then, of course, they also will prescribe antidepressants. And so I would like to suggest that maybe before you go to, pull out those big guns, that you at least experiment with some much safer and very effective cannabis-based medicine. So since CBD is legal federally due to the Farm Bill, it is a product that can be shipped now across state lines. Pretty much everybody has access to it. There are only a couple of states that still have restrictions on it. So what I wanted to do was just do kind of a basic tutorial, so to speak, on how to use cannabis, how to use CBD to manage anxiety. Now, CBD and THC are often confused. So both of them are cannabinoids, which means that the plant itself, the cannabis plant, has hundreds of compounds in it. And those compounds are called either cannabinoids, flavonoids, or terpenes. So cannabinoids are your THC, your CBD, and about 138 other compounds, other cannabinoid compounds. The terpenes are the essential oils, which gives cannabis such a strong smell. It's very easy to distinguish that, yes, that's cannabis. And then flavonoids, which give it its flavor. So when you want to use cannabis or CBD to manage your anxiety, there are a couple of things that you should consider. Number one, CBD is non-intoxicating. So in other words, you don't get high from it, you don't become impaired from it. THC is actually the only cannabinoid that causes that typical stoned feeling, or being high, feeling intoxicated, feeling impaired. So there are ways to use cannabis as medicine and really limit that type of side effect with the intoxication and with feeling high and all of that, you can really almost eliminate that and still get all of the other benefits of using cannabis. Now, CBD, it is non-intoxicating, but it does have psychoactive effects. And those two in particular are anti-anxiety and antidepressant. So CBD has a long list of the different properties and the different medical conditions that it can help with. So for existence, it's a great anti-seizure medication. Little kids who have severe epilepsy and they aren't being managed well using the pharmaceutical drugs, they will often move over to CBD as a way to really control their seizures. And it is so much better than your prescription meds. It's unbelievable. For anybody who's interested, you can watch the documentary by Sanjay Gupta. It's on YouTube, and it's called Weed, and it's like a 6-part documentary. The very first one showcases a little 5-year-old girl. Her name is Charlotte Figge, who has Dravet's syndrome, which is a very severe form of childhood epilepsy, where she was having about 300 grand mal seizures a week. And that was with all of these different pharmaceutical drugs. When they switched over to CBD, her seizures went down to 0 to 1 per week. So a huge difference. And so CBD can really be a game changer, a life changer. It was for me. I was on anti-seizure medications for my tremors, and they were horrible. And I am so grateful that this plant was available to me, because I live in California, and it literally changed my life. So that's why I'm very happy to tell anybody about it who's interested. So CBD also has some other characteristics. It's also a muscle relaxant and an antispasmodic. So when people are experiencing anxiety, a lot of times they've got a lot of muscle tension. They have tension in their neck. They get headaches. And just by taking a little bit of CBD, it can reduce all of those symptoms. And CBD is a much safer alternative to the anti-anxiety medications like Ativan and Xanax and Valium. There is no risk of fatal overdose like there is with those other medications. In fact, nobody in the history of the world has ever died of a cannabis overdose. So in terms of a safety profile, cannabis is much safer than, I would say, every pharmaceutical drug out there, as well as the over-the-counter drugs. People are kind of lulled into a false sense of security that as long as it's over-the-counter, that it's safe. But I mean, I could go through some statistics with you that would, really change your view on that. And I'll just give you one. So every year, about 600,000 people are hospitalized in the United States for bleeding ulcers caused by the NSAIDs, the non-steroidal anti-inflammatory drugs like Aleve, Motrin. Well, you know what they are. And a lot of people die every year from it. There is also reported cases of sudden cardiac death as a result of taking those drugs. So none of those issues are a problem with cannabis. Probably the worst side effect that you're going to have that is transitory. Most of the side effects are very transitory. You may have some dry mouth. You may get sleepy and fall asleep. With the THC in particular, which is one of the things I wanted to mention, is THC can actually cause anxiety if you take too much of it, or if you take a particular chemovar, which is like a strain of cannabis that has certain terpenes in them that are stimulating, like pinene and limonene. So if you do have an issue with anxiety, and if you have been using THC to help with it, you may not be getting the best results that you possibly can. And I would recommend that you switch over to CBD, because CBD is relaxing. It is anti-anxiety. It is a muscle relaxant. And it's a bit of a crapshoot if you're going to use THC to manage your anxiety. Now, there are a lot of CBD products out on the market, over-the-counter products, and most of them, or not most of them, a lot of them are crap, basically. It's an unregulated market, and they are not required to do any kind of lab testing. So, like consumer watch groups have gone into stores at Whole Foods, at CVS, at, all these places that sell CBD. In fact, they even sell it in gas stations, if you can believe it. But anyway, they bought these products and then they put them through third-party testing, and about a third of them had no CBD in them whatsoever. And they may have also had pesticides or heavy metals or molds and bacteria. So when you choose a product that you don't know has been lab tested and you can't actually see those lab results, you're really gambling. Because you could be getting none of what you want and a lot of what you don't want. So you need to really consider this as medicine and take it with and make your selection with as much caution and thoughtfulness as any other kind of medication. So I highly recommend that you only use lab tested products. And the way you find that out is you just go onto the brand's website and you can look to see what it's also called COA, Certificate of Analysis. So look for either lab results on their website or COAs. And if they do third-party testing for these over-the-counter medications, they are going to make sure that you know it, because it is like a badge of honor. So if they don't have it, it's going to be hard to find, or you just won't be able to find it at all. If they do lab tests, it's going to be pretty much front and center. So only use lab-tested products. You can use CBD in a variety of different ways, whether you want to use a tincture or if you want to smoke it, which I don't really recommend because it's very irritating to the lungs. But you can use edibles, gummies, beverages. There are a lot of different methods of ingesting CBD. So it really is a personal preference. But in terms of what effect it has on you, each mode of ingestion, whether it's, if you smoke it, you're going to get some immediate results, but they're only going to last for a very short period of time, versus if you ingest it, either with a tincture or an edible, it is going to take longer before you start to feel the results, but the results will then last for 6 to 8 hours. So oftentimes with my clients, my cannabis clients, we'll use CBD, sometimes with or without THC at night. And the reason is it will help them fall asleep if they take it maybe an hour or two before they want to fall asleep. And then it will keep them asleep to 6 to 8 hours, versus if you use the inhalation method, it may put you to sleep, but it is not going to keep you asleep. So that's why I prefer using the tinctures and the edibles. Now, unfortunately, a lot of the edibles have a lot of sugar in them, which is really something that you're going to want to avoid during this transition into menopause. So yeah, I would recommend using a tincture. And generally, it's a much better value. You're going to pay more for the, production of the edible product. Now, finally, with dosing, this is a big question that most people have. You're going to want to start with a very low dose and slowly increase it every 3 or 4 days until you get the response that you're looking for. So with CBD, a good place to start is around 20 milligrams and see how you do with that. With THC, I would start more at about 2 milligrams. If you want to include that as part, and if you're in a legal state, and all of those requirements. Now, there are a couple of things you need to be aware of when you're using CBD. The first thing is that it can have some drug interactions, and the two drugs that I always make sure people know can be affected by CBD are anticoagulants, particularly Coumadin, and also beta blockers, which are a type of high blood pressure medication. So if you are taking those, if you can separate by at least 2 hours the time you take your prescription medication and the time you take your CBD, you should be fine. But if you are on Coumadin, or if you are on one of the beta blockers like propranolol, you're going to want to be monitored just to make sure that you're not building up any excess of those medications in your bloodstream. So, and then in terms of increasing the dose, you want to do that every 3 days. And you can do that either by adding another dose or increasing the amount of the one dose. Because some people, maybe they don't want to take CBD before, first thing in the morning before they start their day, and they prefer to take it later in the afternoon. So if you're just taking it once a day and you need to increase it, you can increase it with the one dose that you're taking. So just to give you an idea, I take my CBD every night, and I need about 250 milligrams of it so that I don't shake so bad that I can't do things. It's a much higher dose than a lot of people need. But if you start with 20 and you slowly increase over time, you will feel the dose where you're like, oh, okay, I feel great. I'm not anxious. I don't feel, too sleepy or too relaxed. And this is working. Then you've hit your dose. And everybody has to find their dose. There is no one size fits all with cannabis. And if you try different products, you have to kind of start over at the same lower dose and then increase, because every brand uses different plant material, and you don't want to take too much right out of the gates. You just want to slowly find your dose. So that is a little information on using CBD and cannabis to manage anxiety. And as we go through other symptoms of menopause, when it's applicable, I will include a video specifically on using CBD and cannabis to manage that particular symptom. Well, okay, if you could subscribe and hit the like button and hit the bell, that would really help me promote my channel. If you like this content, I'm very happy about that, but I would love to hear your comments and your other concerns about menopause. This actually came about because one of my viewers sent me a comment saying that her 3 most challenging aspects of menopause are anxiety, weight gain, especially in the middle, and sleep. So I think I've pretty much covered anxiety at this point, and now I'm going to move on to sleep and to weight loss. Okay, thanks ladies. Bye-bye.